Hi, this is Dr. Tanio with Resolure Health, and today we are going to discuss the potential utility of hyperbaric oxygen therapy on long COVID based on a recent randomized placebo-controlled study from Israel. Long COVID is a global challenge. COVID has infected more than 750 million people as of early 2023. It is very likely that 10 to 20% of those people infected with COVID will develop a post-COVID or long COVID type of syndrome, which is more than 75 million people across the globe. It is a symptom complex that looks like myalgic encephalomyelitis or chronic fatigue syndrome, and some of the key components are persistence of the virus in the body for months, inflammation of the blood vessels, microclots or hypercoagulability, neuroinflammation, as well as fatigue, neurologic, and psychiatric symptoms. Importantly, there are no FDA-approved treatments. What do we know about hyperbaric oxygen before this study occurred? We know that hyperbaric oxygen helped to heal wounds and reduce inflammation shown over multiple decades. Hyperbaric oxygen is a drug that has two separate components. There is a dosage of oxygen and a dosage of pressure, both of which are separate. There are genes in the body that are sensitive to oxygen and different genes in the body that are sensitive to pressure that are almost immediately responsive when patients are put in a hyperbaric oxygen chamber. As a result, there can be several neuroplastic effects in the body, including improvement in mitochondrial function, increased blood flow, and migration of stem cells. There had been small studies on long COVID and hyperbaric oxygen before this research was done without placebo groups, and they showed positive improvement. But an important thing to note in this study was that there was a very good placebo and control group. And the reason why this is important is because there has not been good placebo-controlled studies in hyperbaric oxygen in the early 2000s and 10s. What was being done instead was that there were soft chamber hyperbaric oxygen used as a control. However, the problem was that patients who were getting soft chamber hyperbaric oxygen were actually getting an intervention because those patients were getting some degree of both oxygen and pressure. As a result, many of the studies showed that both the controls and the intervention group were getting better, and as a result there was limited coverage for hyperbaric oxygen therapy for neurological conditions by insurance. In this study, as in a couple of prior studies, the Israeli researchers created an extremely clever placebo-controlled design. What happened was that all subjects were put in a large chamber which seated several people and were given air masks. If you had true hyperbaric oxygen, the pressure went up in the room and you were given oxygen to breathe. However, if you were in the placebo group, what happened was that the pressure was increased for the first 5 minutes, and then the pressure went down to just above normal atmospheric pressure, and you were given room air instead of oxygen. When they surveyed patients to see if they knew whether they were in the placebo group or not, the subject could not tell the difference. Other parts of this design included that patients needed to have post-COVID symptoms for at least 3 months to be enrolled. There were 37 patients in the treatment group and 36 patients in the control group. Patients had measures of blood perfusion in their brain, cognitive performance tests, and detailed surveys and assessments, and patients received 40 sessions of hyperbaric oxygen with air breaks at 2 atmospheres with an oxygen mask. The researchers tested improvement in brain performance in a couple of different dimensions. They used a global cognitive score, they tested executive function, as well as attention using computerized brain testing. In all of these areas, the group that received hyperbaric oxygen improved more than the control group, and it was found to be statistically significant. The researchers did detailed questionnaires on symptoms. The group that received hyperbaric oxygen improved in a statistically significant manner in the following domains: physical limitation, energy, somatization, depression, anxiety, sleep, and pain. The researchers also found that the group that received hyperbaric oxygen had improvement in brain perfusion as seen by MRI. These were in areas of the brain that were associated with cognitive and emotional roles. Patients who had the most improvement in brain perfusion also had the most improvement in symptoms. There was a tight correlation. So what should we make of this data? This is the first prospective randomized placebo-controlled trial that has demonstrated significant improvement beyond the expected clinical recovery for patients with post-COVID. The researchers used a rigorous placebo control and used multiple methods of looking at clinical improvement that were aligned with each other. They looked at brain performance, blood flow, and symptoms. I believe this is an excellent study, and the regulators and insurance companies should look through this data and really consider coverage for hyperbaric therapy for long COVID. At a minimum, the insurance companies should cover the therapy with the stipulations that patients enroll in a follow-up study so that we can get more data. It is important to emphasize that there are no FDA-approved therapies at this point, and we are not providing any medical advice. However, patients who are looking for options for long COVID should consider discussing with a physician the utility of hyperbaric oxygen therapy along with other potential therapies that could address other parts of the pathophysiology of long COVID, including addressing blood and vessel inflammation, addressing microclots, and addressing persistent viral replication. We would be happy to answer any questions you have on hyperbarics or long COVID. Just call 1-866-RESOLIR or go to our website, www.resolirhealth.com. I'm Dr. Craig Tanio, and thank you for listening to this video.